Okay, next is on child health assessment, and let us deal with assessing history, physical examination, vision, hearing, speech, intelligence, temper, and developmental tests for children. Alright, so first, sa nursing history, importante sa interview setting na comfortable yung bata. Mostly for younger children, your primary source of information is of course the parents or the guardian. Pero for older children, lalo na pag kaya naman na makikooperate, syempre, much better na sa kanila mismo magagali ang information. Isa sa importanteng aspeto dito yung interview setting, kaya sa mga pediatric wards, no, more of colorful playground, no, or background yung meron doon sa lugar. Sometimes even yung uniforms ng nurses, no, yung mga scrub suits ng mga cartoon characters, so para mas maging mas applicable, no, at mas ma-appreciate ng mga bata yung mga healthcare workers within hospitals. Right? For physical exam, of course, you still follow the usual IPPA. So, inspect, palpate, percuss, auscultate, cephalocaudal. Of course, depende lang, no? Iba kapag abdomen, no? IAPP. Alright? Let's also consider sa physical exam na among children, may mga cases na mas uunahin mo yung less invasive na tests. Alright? Kasi kapag kinakalikot na yung tenga, yung ilong, yung bibig, minsan umiiyak sila or nawawala doon sa momentum yung mga bata. Nawawala yung focus ng mga bata. So, maaaring yung mga ganon, they fear mutilation, yung ginagalaw sila, no? Pag mga ganon, mas better na last na i-assess yung mga body parts na yun. Alright? For vision tests, well, for young children, of course, they appreciate colors already. For newborns, ang kita lang talaga niyan, mga black and white. Pero eventually, ma-appreciate nila yung colors. Alright? Of course, alam natin na nakakakita yung bata. Kasi unang-una pa lang, no, nare-regard niya yung mukha ng mga primary caregivers niya. And then, na-appreciate din niya, no, may social smile siya. Natutuwa na siya sa paligid niya or surroundings niya. Snellen chart is one way to test, of course, the visual acuity. Alright? Sa Snellen chart, nakikita dito yung normal vision 2020 for children na achieve actually ang 2020 usually at 7 years old. So, ang ibig sabihin ng 2020, no, yung 20 feet distance na standard from the letter. And of course, OD right eye, OS left eye, OU both eyes. So, kung halimbawa, both eyes are 20/20, no, your visual acuity is normal. For example, it's 20/200, both eyes. It means that both of your eyes can only see at 20 feet what a normal person can see clearly until 200 feet. Okay? Ngayon, instead na ikaw yung lalayo dun sa letter, yung letter syempre yung pinapalayo sa'yo. Kaya lumiliit yung letters from the Snellen chart, which means lumalayo yung letter. No? Standard feet distance. Paano yung mga batang hindi pa nakaka-appreciate ng letters? No? Pwede yung E chart. Just the letter E, pero saan nakaturo? Right side, left side, up and down. Okay, so preschool E chart. And then yung Allen cards naman is just a way for us to see if children knows to appreciate also yung bukod sa vision, color, and even yung mga normal or basic things, the usual things. So in this photo, what can you see? Can you describe what can you see? So may sun, may trees, may bird, may water. Okay, that's basic. Alright, hindi na kailangang i-describe pa niya na anong klaseng bird yan, anong klaseng body of water yan, anong klaseng puno yan, no? Just the child can appreciate. Ito naman, may nakikita siyang chicken, no? Hindi naman kailangan sabihin niya rooster pa yan, no? Basta't alam niya it's a chicken, that's enough, no? Na-appreciate niyo yung color, that's enough. Yun yung Allen cards, alright? So vision tester, this uses machines, no? They can really appreciate, no, the characteristics ng eyes, minsan even the posterior parts of the eye, pwedeng ma-visualize, no? Cover testing can check strabismus or misalignment of the eyes. Color vision deficit testing, ano ba yung nakikita natin dito? No? Color blindness is usually a problem among males kasi sex-linked recessive trait siya. Okay? Now, what about hearing? No? Principles of audiometric assessment, no? Checking for frequency and loudness of sound. Alright? Normal frequency of sound, 500 to 2,000 hertz, and normal loudness of sound, 0 to 60 decibels. So kapag may abnormalities dito, may mga problems of hearing condition or hearing impairment, maaring gumamit ng audiometer to detect gaano ba tagal yung frequency, gaano kataas yung decibel bago masabing may naririnig ang batang ito. Alright, ngayon meron na rin tayo ng tinatawag niyang newborn hearing, no? Screening program. Alright? Ngayon, different kinds of hearing difficulties, no? Slightly deaf, the child is unable to hear whisper, wala namang speech impairment, maaaring may hearing difficulty, leaning forward and speaks loudly. Mild, no, deafness, maaaring may beginning speech impairment na, difficulty is hearing if the child is not facing the speaker. Moderate deafness, may speech impairment na, may require speech therapy, nahirapan na siya with normal conversations. Pag severe deafness, difficulty hearing any nearby loud voice. Hears vowels more than consonants, speech therapy ulit, pero naririnig lang niya yung sobrang lalakas ng mga jet or whistles ng mga trains, which are very, very loud. And profound deafness, hears almost no sound. Ngayon, may mga test din tayo, no, to check if there is conductive hearing loss. Ang conductive hearing loss is a problem of either air or bone conduction. Pero yung sensory neural hearing loss, which means may problema talaga doon sa nervous system, most probably, no? Pero pag conduction hearing loss, it's either the air or bone conduction. How sound enters and is being conducted towards the ear hanggang maka-interpret si brain. So I'm sure you are still familiar with the Weber's and the Rhines test. No? The Weber's test assesses bone conduction. The Rhines test or the Renes test assesses both air and bone conduction. Okay? Now, for speech assessment, we have this Denver articulation screening test. The Denver developmental materials are US-based, pero dito, no, sa kanila, papasabi sa mga bata yung mga words na ito. 2 to 6 years old, 22 words to be repeated. Tapos, kinoconsider pinakikinggang maigi yung mga naka-underlined letters. Alright? Raw scores are compared with a percentile rank for every age if they have a speech problem or not. In the Philippines, hindi ito pa nagagawan ng counterpart. No? In fact, sa atin nga, even mga adults, they really have speech problems. Alright? For intelligence, no, yung mental age divided by chronological age times 100 is the IQ. Alright? Ngayon, may mga basic IQ tests na pwede nating i-check doon sa mga bata. Right? In fact, when you took the entrance exam also here in college, may mga IQ test din na ibinigay sa inyo to determine how well your intelligence is, no? Like for example, dito simple sa mga bata. Between two women, sino yung mas maayos yung itsura, no? Syempre ito. Between the two males, sino yung mas maayos yung itsura, no? So you can specifically just ask the child to choose, no? This one, no, higher IQ, ano kaya ang background color no question mark na box, so it should be green, right? Ano dapat yung first shape dito? It should be an inverted triangle, no? Anong color dapat? It should be red. Alright, dito naman ano dapat ang shape? It should be a normal triangle. Ano dapat yung color niya? Color dapat blue. Alright? So, may mga ganong test kayo na tinitake minsan. Dito naman, anong klase? Ano ang mga nakikita mo dito sa pictures na ito? So, may mga nagsabi, may rooster, may church, meron daw sementeryo, merong crib ng bata, may elephant, may nakakita ng camel. Okay? So, iba-iba yung pwede mong ma-interpret. Alright? This one also, no, sometimes you can ask older children naman to read. Even if the first and the last letter lang yung nasa tamang lugar, no, by intelligence, no, nababasa mo siya as a whole. Okay? Temper. Alright. So, sa lahat ng pediatric age group, ang pinakamahirap ang temper, again, as what I've said, are the toddlers. Alright? They have the most problematic temper. May test ulit, but it's a US-based test. Yung Carey-McDevitt Infant Temperament Questionnaire. It's a 95 responses, no, taken in 25 minutes, pero ito ay for infant. 4 to 8 months siya pwedeng gawin. So, feeding, sleeping, soiling and wetting, dressing, bathing, diapering, people, new situations, yun yung mga ina-assess doon. But then again, sa lahat nga no, ng age group, it's the toddlers really who have the most difficult temper. And, importante syempre yung pag-discipline ng parents when it comes to that. Alright, difficult, slow to warm up, intermediate, and easy temper are the different kinds of temper na hindi lang pang bata na may-describe din natin until the adult period. Alright, and last is the developmental test. This is the MMDST, which is most important for this part of the lecture. Now, ang MMDST, it's a screening test to determine if the child's development is normal or delayed. It's just a screening test. It will not diagnose yet. Alright? It's for children 2 weeks until 6.5 years old. Modified and standardized ito by Dr. Phoebe Williams from DDST, Denver Developmental Screening Test. So, US-based siya. Minodify as standardized para sa Filipino children. Kaya siya tinawag na MMDST, Metro Manila Developmental Screening Test. Ideally, dapat magagawa niyo ito kapag kayo ay nagpunta sa hospital, sa pediatric ward, lalo na doon sa Hospicio de San Jose. Pag nandun kayo sa duty na yon, well, third year, ideally yun na duty kasi nandoon yung mga bata na abandoned, mga orphans. So you really need to check because we do not know, no, if they are developmentally delayed. So, may screening test na ginagawa. Alright? And to help you understand better about MMDST, I provided the MMDST manual, which you need to read. Self-explanatory yun. Okay? Meron ding MMDST screening score or the scoring sheet. And of course, yung video, which you need to watch also. Pero reading the manual is most important para maintindihan nyo kung paano ang MMDST. Okay? Ngayon, ang MMDST ay ine-evaluate ang 4 aspects of development. Personal, social, tasks which indicate the child's ability to get along with people and to take care of himself. Yung fine motor, tasks which indicate the child's ability to see and use hands. Language, of course, child's ability to hear, follow directions, and speak. And gross motor, it indicates ability to sit, walk, jump. Ito rin yung pagkakasunod-sunod ng mga ng sequencing, no? Sa MMDST test mismo. Yung personal, social, then fine motor, then language, last yung gross motor. Okay, this is the MMDST form. Sa form na ito, no, makikita nyo sa taas yung age. 0 months, no, hanggang 24 months, pero pagdating dito, years na siya, hanggang 6.5 years old. Alright, and then ito, may 4 na sector. First sector is the first long rectangle. Ito yung first sector na personal social. Second sector, ito, lahat yan. No, yung second sector na yan, yan naman yung fine motor adaptive. Third sector is this one. This is the language. And then last, gross motor sector. Ito, age line din yan. Age line, kamukha ng age line dyan. So you just need to write the details of the child here. Okay? Yun. Preparing for the test involves, of course, you having the complete test kit. The test kit, we have a test kit in the school. Unfortunately, we cannot do it and use it for now. So the kit is a small blue bag which contains the following. Andun yung manual, but I've provided you a soft copy of the manual for you to read your test form. Tas may mga materials. Itong mga materials na ito ay ilan lang dun sa mga material na kailangan mo to perform the test. But you will not be using all of this. Kasi depende lang yung gagawin mong test sa bata dun sa age niya. Okay? So, that's the first thing you need to do. Get the age and the age time. So, compute the age of the child, subtract the birthday kung kailan mo siya itetest. Remember, if the child is premature, subtract the number of weeks of prematurity. So, kung ang bata ay 36 weeks AOG nung pinanganak, normal is 37 to 42. So, kulang siya ng 1 linggo. Okay? So, kung ngayon, ang bata ay 10 months, no, bawasan mo ng 1 linggo. So, 9 months and 3 weeks yung bata. Okay? Yun yung kanyang age. Pero, subtracting the prematurity is only true if the child is less than 2 years old. Kahit premature pa siya, pero more than 2 years old na siya, you have to use the actual age. Okay? And then, after computing the age, you just draw the age line in the test form. How do you draw the age in the test form? So, ito yung age line. So, yan. Example, 10 months yung bata. So, using a ruler, 10 months sa taas, 10 months sa baba, just connect them. That's the age line. Sa taas nila, nakalagay December 8, 2020. Lalagay ko dito yung date kung kailan ako nag-take ng test. Okay? So, may age line ka na. And then above it, write the date of the test. So, ano ngayon yung ibig sabihin nitong age line na yan? Lahat lang nung mga bar. So, bars yung mga yan. And each bar represents a test. Okay? A test item. So, bawat isang sector, kung ano lang yung dadaanan ng age line, yun yung gagawin kong test dun sa bata. Okay? Paano ko malalaman yung test? Nakalagay siya dyan sa bar kung ano yung pangalan ng test. At paano ko malalaman kung paano gawin yung test? Nandoon sa MMDST manual. Okay? Now, this is an example. So, for personal social and fine motor. Look at the first sector, personal social. Walang dinaanang bar yung age line. Kung wala siyang dinaanan, ang gagawin ko are the 3 bars to the left of the age line. Ano yung unang bar? Ito. So, I will find this test in the MMDSD manual and do it. Ano yung susunod na bar? Ito. Ano yung pangatlong bar? This one. Okay? So, kung ano yung immediately to the left. Alright? Ito naman, ano lang ba yung nag-intersect sa age line? 1, 2, and 3. Okay? So, yun yung bar. Alright? Yung bar, parang may makikita kayong shaded doon sa last part ng bawat bar, di ba? I will explain that in a while. Pero, yung buong yan is just 1 bar. So, yun ang ibig sabihin nun. Okay? Now, this one is 1 bar. Okay? So, ano tong bar na to? Walks well. Yun yung pangalan ng test. So, para magawa ko to sa baby, kung nag-intersect ito doon sa age line, gagawin ko siya walks well, hahanapin ko lang yung instruction doon sa manual para magawa ko yung walks well na test. Okay? Ngayon, lahat ng bar, no, may makikita ka na mga labels. Okay? This one is the hatch mark. Alright? Ibig sabihin ng hatch mark, so lahat ng bar, like this one, ito yung hatch mark niya. Okay? The hatch mark represents 50%. What does that mean? 50% of children who pass this test, no, sa age line na yan, ay nakakapasa ng test. Okay, so if you look at this, ano bang age ito? 13 and a half months. Okay, a child who is 13 and a half months, 50% of children 13 and a half months can pass this test, which is walks well. Okay, ito, ano ibig sabihin yan? Dulo na yan. 12 months children, no, 25% of children aged 12 months can pass this test. Ano ibig sabihin itong first dark line? Kasi dark na to eh. 75% of children aged 15 months can pass this test. At ano yung huling-huli? No? Approximately 17 and a half months, no? 90% of children, 17 and a half months, can pass this test. Okay? So, kung ito yon, no? Ito yung hatch mark, 50%. Ito yung 25%, ito yung 75%, at ito yung 90%. Depende kung saan siya nakatapat na age line. Sa age. Okay? So, yun yung hatch mark, 50%. Sa hatch mark, laging naglalagay ng result, which is, I will again discuss later. Okay? Minsan naman, may mga items, may makikita kayong R sa upper left ng bar. So, this is another test. Walk up steps naman yung pangalan ng test. So, ibig sabihin ng letter R, this test can be passed simply by report. Kahit hindi siya magawa ng bata, pero sabi ng magulang, ay oo, nagagawa po niya yan. Ay oo, lagi ko siya nakikitang ginagawa yan. Ay oo, nasasabi niya yan. So, pwedeng ipasa yung bata by your report. Pero kung hindi nakalagay yung R, like this one, walang nakalagay na R, you cannot pass it by report. You really need to see the child do the test. Okay? Minsan din, may mga items merong number naman sa lower left. Yun yung footnote. Footnote are just additional guidelines when administering items. Again, ang mga footnote, makikita yung additional guidelines niyan doon sa MMDST manual. Okay? So, ngayon, 105 lahat ng test items. But the examiner will only administer the items that the age line passes through from top to bottom for each of the 4 sectors, which means kung ito yun, again, sabi ko nga kung ano lang yung nag-pass through ng age line. Kung babalikan ko naman ito, kung ano lang yung nag-pass through ng age line. Walang nag-pass through sa first sector. So, yung first 3 to the left, first, second, third, fourth, fifth, sixth, 7, 8, 9. So, mag-umpisa ka lagi to the left, pabalik. Okay? Pero first 3 lang. So, 1, 2, 3. Ito yung itetest ko for this. Dito, anong itetest ko? 1, 2, 3. Kung ano lang yung nag-pass ng age line. Okay? Ngayon, paano siya sinuskoran? P, F, R, or NO. Alright? Again, P, F, R, or NO. Saan nilalagay ang P, F, R, or NO? You put it always on the hatch mark. So, kung andito yung hatch mark, dito ko lalagay yung P. Kung ito yung hatch mark, dito ko lalagay yung F, yung R, or yung NO, kapantay ng hatch mark. Alright? When you say P, pasado, nagawa niya ng maayos. Or, kung may nakalagay na R, kahit hindi niya nagawa ng maayos, pero sabi ng magulang, opo, kaya niya yan, P pa rin. Yung F, if the patient was not able or the child was not able to perform. No? Even by report, kung pwede siyang passable by report, pero F pa rin. R, refuse. Ayaw gawin ng bata. No? Lalo na at hindi naman siya pass by report. Kung NO, no opportunity. For example, meron siyang item about trying the bicycle. No? Ay, sabi ng magulang, hindi pa po niya nasubukang mag-bicycle eh. So, hindi ko alam kung kaya ba niyang gawin yun or hindi. Hindi mo naman matest, no? Kasi walang bicycle. Okay? So, yun yung NO. So, P, F, R, or NO. But as much as possible, kailangan ang makuha nating results either P or F. Iwasan natin yung R, refused, o kaya yung NO, no opportunity. Okay? Now, for each sector, if F occurs on any items that pass through the age line, proceed to administer items to the left of the age line until 3 passes have been obtained. So, look at this. Dito sa sector na to. So, anong sector yan? Language. Ano lang yung i-administer ko? Kung ano yung nag-pass sa age line. So, ito lang, tsaka ito. Eh, ang kaso may F. No? May isa kong F doon sa age line. Ibig sabihin, kailangan kong mag-test pa ng 3 to the left. 1, 2, 3. Okay, which is pass naman siya. Alright? Pero kung ito, pareho namang P, I don't really need to do tests on the left side. Okay, ibig sabihin, mga pang-younger skill kasi ito. Okay, ito pang older skills. No? Ngayon, dito naman, ganun pa rin. Regardless if may P or may F, no? Lalo na pag may P. Okay, pag may P dito, subukan ko namang mag-test ulit nung 3 naman to the right of the age line, which is 1, 2, and 3. So, kaso puro F lahat yan. Which is actually okay. Kasi, pang mas matatandang skill yan. No? Eh, ang kailangan lang naman niya, ito. Alright? So, ito lang talaga yung gusto kong screen for now. But then again, sa isang sector, ito lang talaga yung gagawin ko dito sa sector na to. Pero kapag may isang F, kuha ako ng 3 pang test to the left. Okay? Kung naman may P, kuha ako ng 3 test to the right. Alright? Look at this one again. So, dito sa sector na to, gross motor, ito ang mga dapat kong kuhanin. 1, 2, 3, 4, and 5. Kaso, meron akong F, no? So, I need to do 3 tests to the left, which is 1, kasi hindi siya nag-cross ng age line eh. 1, 2, and 3. Okay, ngayon may P. Meron ding P. So, go to the right naman. 1, 2, and 3. Okay, actually, kung gusto mo nga i-test lahat yan, no problem. Yun nga lang, siguraduhin mo na uunahin mo munang i-test yung mga mas batang skill kesa yung mga mas mahirap na skill na pangmatanda. Okay? So, again, no, in items with P on the age line for each sector, continue testing now to the right until 3 times na nag-fail. If the item is F and is completely to the left of the age line, yun yung delay. You must shade the right end of the bar. Okay, so pagkatapos mo nang nagawa yan, no, you have to now check alin dyan ang delay. Okay, syempre, ang delay lang ay yung may mga F. Pero hindi lahat ng F ay delay. This one, failed siya. Pero kung titignan mo, ano ibig sabihin ng age area na yan, di ba? 75% of children can pass this test. Ibig sabihin, posibleng wala siya dun sa 75 at hindi naman yun failed. Or hindi yun delay. Failed siya sa test, but this is not a delay. Ibig sabihin, basta't nag-pass ng age line, no, at fail, hindi yun delay. Alin ang delay? If nag-fail siya doon sa mga test na completely to the left of the age line. So ito, nag-fail. Yun yung delay. Ida-darken mo lang yung last part ng bar. Okay? Dito, meron ba siyang failed doon sa mga completely to the left of the age line? Wala din. Ano ba yung mga completely to the left of the age line? This one, and this one. Hindi rin naman siya doon failed. So kahit F ito at kahit F yan, it's on the age line. Which means ito nga no? Ilang percent lang naman ang nakakapasa dyan. Diba? Ito din, ilang percent lang ang nakakapasa dyan. Yung hatch mark, diba? 50%. Okay? Pag nandito, 90% lang nakakapasa. Basta't nandun pa siya sa age line, okay lang na fail. No? Pero kapag completely to the left of the age line at nag-fail, yun yung delay. So, 2 sector lang yung nakita rito sa test na to, pero yung nasa taas niya normal din. Therefore, sa ibaba, I will write the interpretation. 4 yung interpretation. Abnormal, questionable, untestable, normal. You put the results at the bottom of the age line and put the reason. So, dito, normal. Reason, no delays in all sectors. How will you now interpret this? All of these are written self-explanatory doon sa MMDST manual. Kung kailan nagiging abnormal, questionable, untestable, and normal. Alright, so ulitin ko lang. There are 4 sectors, no? This is the 3rd sector, language. 4th sector, gross motor. Age line yung unang dapat makuha. Ilagay yung date of test sa taas ng age line. Okay? Ngayon, kung ano lang yung nag-pass through ng age line, yun ang mga unang gagawin na test. Okay? Ngayon, kung doon sa ginawa mong test, okay, merong F, go 3 skills to the left. Alright? Pero kung walang may F, automatically proceed 3 skills to the right. Alright? Kailan lang siya magiging delay? If the F is completely a bar to the left of the age line. So, dito, walang delay. Kasi lahat ng mga completely to the left of the age line, ito, tsaka yan. Lahat naman, pass. Ito, kahit na F yung mga yan, it's okay. Because they are still on the age line. Which means, meron pang mga porsyento ng bata na hindi talaga yon magagawa. Na malamang nandun siya dun sa ilang percent na yun ng bata na hindi magagawa. Which is explained by this percentage. Okay, so halimbawa, andito yung age line niya, no? Ito yung age line. Tas F siya, ilalagay mo sa hatch mark. Hatch mark is the 50%. Andito yung F. Okay lang na F yan, kahit nandito yung age line mo. Why? Because according to the age line, 80%, sabihin na natin 80% yung age line na yan kasi 75, 90, no? 80% of children can pass this test. So kung F siya dito, baka nandun siya sa 20% na hindi pass. And that is normal pa rin. That's not a delay. Okay? Paano kung nandito yung age line? Dun sa mismong 90%. Tas F pa rin yung nakalagay dito sa hatch mark. That's still not a delay. Why? Because it still touches the age line, which means 90% of children pass this test. So, baka nandun siya sa 10%. Okay? So, lahat yan pare-pareho. 25, 50, 75, 90. So, kailan siya lang nagiging delay? If the item is an F and it's completely to the left of the age line. Kung ang age line ay nandito, no? Completely to the left of this bar. Tas F yan. Yun yung delay. Okay, but if it touches the age line, if it is on the age line, kahit na F pa yan, hindi siya delay. Only for that test. And then eventually, i-interpret mo siya. Alright? Tapos ilalagay dito ang result. Again, I want you to read the MMDST manual. It's very self-explanatory. You will understand there kung paano mag-score ng pass, fail, refuse, no opportunity. Tapos bawat result na yon, kailan siya delay or not a delay, and then kailan magiging abnormal, questionable, untestable, and normal. Yung mismong MMDST result. Alright? And to end, no, these are just contemporary pediatric issues that we are all aware of. Child labor, child abuse, adolescent pregnancy, and street children. Well, these are actually pediatric issues and concerns that concerns many Filipino children. Alright? So, bilang future healthcare providers, no, you should be aware of issues in our country about this. So, I have shared some files about these issues. And of course, you should also read many things about these issues in our country. Okay? Being in the new millennials, no, dapat isa kayo sa mga nagiging advocates ng mga bata because children should be well taken care of. And of course, these issues affects their health in so many ways. Alright? At magiging mas malalim pa ang mapapag-aralan natin about this again when we deal with MCN 2 already, including your medical surgical subjects in the future. So, dapat lang aware kayo sa mga nangyayaring contemporary pediatric issues and concerns na ito sa paligid, no, in the Philippines, all over the world also, about these concerns. Alright? So that's the end of our MCN 1.